Risk factors mainly would have to do with you having multiple sexual partners. Multiple sexual partners, okay? And then sometimes it's even you having a partner who has multiple sexual partners. So not necessarily you having the multiple sex, but the partner that you have has multiple sexual partners, okay? And then people who may have had certain STIs already. So if you already have a sexually transmitted infection, it reduces your immunity, such that now when you do have the HPV infection, it reduces your chances of clearing the infection, especially if it's the high risk, and then this can end up developing into cervical cancer.
Okay.
Another could be that our good old HIV, if you do have HIV, it also reduces your immunity. Others are if you do have any other cancers within your body, that can also reduce your immunity and then reduce the rate at which you can actually clear this infection. And then if you have family history, so family history of somebody in your family who may have had cervical cancer before, it also predisposes you to having higher risk of developing cervical cancer. And then the early coitus, so the first time that you may have been exposed to sexual intercourse. If it's at a very early age, it means that if you are not screening, that means that assuming somebody, their first sexual intercourse was at about age 18, as opposed to somebody whose first sexual intercourse was at about 25. So if you look at the 18 and then the 25, the difference is about 7 years. So for 7 years, this 18-year-old, since he or she is sexually active, has the higher chance of developing cervical cancer because of exposure, as compared to somebody who has had her first sexual intercourse at 25.
Right.
You get it? So that is also a risk factor for developing cervical cancer. But really, it's very important because sometimes, and it's very important that we know about it because sometimes you having either the infection or the precancerous lesion may not come with any signs and symptoms at all. You may not know, you may not have any signs and symptoms at all. So that is why the emphasis is on what? Screening, having the right high performance screening test for the right age at any point in time. So some of the signs and symptoms associated with cervical cancer may be, as I mentioned, no sign or any symptom at all. Another could be if maybe you have the overt cancer, you may end up with bleeding, abnormal bleeding. So abnormal bleeding, let's say intermenstrual bleeding, so you bleeding when it is not the time of the month, or you having bleeding anytime you have sex. So we call it postcoital bleeding. So that can also be, or you can have some foul smelly discharge, depending. So